A few weeks ago, I spoke to you about hand sanitizer containing technical grade ethanol and one of the impurities in technical grade ethanol, which is acetaldehyde. Some questions have come in regarding exposure to acetaldehyde, so I want to talk to you about that in more detail and explore that further. When we think about exposure to acetaldehyde, there are two main exposure routes we need to consider. One is inhalation, and the other is skin absorption. Every liquid has a potential to produce a vapor. A vapor in the air has a potential to be inhaled, and a liquid on the surface of a surface has potential to be absorbed through the skin. All liquids have a vapor pressure. You can think about atmospheric pressure pressing down upon the liquid, and the vapor pressure are those molecules pushing up against atmospheric pressure. The higher the vapor pressure, then the quicker a liquid substance is going to evaporate. Now again, the key ingredient in hand sanitizer is ethanol. So the vapor pressure of ethanol is 59 millimeters of mercury, which means that ethanol evaporates quite readily. This is why when you apply hand sanitizer, your hands dry fairly quickly. The quicker that a liquid evaporates from your skin, the less potential it has to be absorbed through the skin. Now, studies have been done to examine how ethanol in hand sanitizer might be absorbed into the body. And one study in particular compared two conditions. Condition one, where people use hand sanitizer normally, where they could have inhaled the ethanol vapor, and ethanol could have also been absorbed through the skin. And they compared that to condition two, where they use a special exhaust fan system to prevent any inhalation exposure of ethanol vapors. And what they found in the first condition, when ethanol vapor could be inhaled, was that the peak absorption of ethanol was about 20 times greater than the condition where inhalation was prevented. And again, we're talking about very small amounts of ethanol here. So what this study demonstrated is that when hand sanitizer is used, any ethanol exposure occurs mainly through the inhalation of ethanol vapor, and very little, if any, ethanol is absorbed through the skin. So that's ethanol, again, the main ingredient in hand sanitizer. But what we're talking about or concerned about with technical grade ethanol is the acetaldehyde content. Now, ethanol and acetaldehyde have very different vapor pressures. The vapor pressure of acetaldehyde is about 15 times greater than that of ethanol, which means that acetaldehyde evaporates much more quickly than ethanol. Therefore, the acetaldehyde in hand sanitizer would be even less likely to be absorbed through the skin than the ethanol that's in hand sanitizer. So, if someone is using hand sanitizer made with technical grade ethanol, the main route of exposure to acetaldehyde would be the inhalation of acetaldehyde vapor. And this is reflected in Alberta's Occupational Health and Safety Code, which has an occupational exposure limit for acetaldehyde vapor. But the Occupational Health and Safety Code also specifies that acetaldehyde is not a substance that may be readily absorbed through intact skin. What we did, like we would for any chemical exposure that we might experience in the workplace, is we conducted an exposure assessment to determine if our exposures were well within legislated occupational exposure limits. So we had a volunteer wear a sampling tube that was clipped to their collar, and that sampling tube collected acetaldehyde. And this was taken from the breathing zone of the individual who was applying hand sanitizer over different experimental conditions. And there were 4 separate conditions that we studied. In the first couple of conditions, we used a medium-sized conference room with normal room ventilation, and we had 2 hand sanitizer use frequencies. One was every 4 minutes or 15 times in 1 hour, and the other was every 80 seconds or 45 times in 1 hour. And in the other 2 conditions, we then moved to a small room where the ventilation was blocked off and the door was closed to try and minimize any air circulation. And again, we applied hand sanitizer every 4 minutes or 15 times per hour, or every 80 seconds for 45 times per hour. And for each of these conditions, we measured the acetaldehyde vapor that was in the breathing zone of the individual who was using the hand sanitizer. And what we found, and the results are summarized here, is for the medium-sized room with normal ventilation, the acetaldehyde vapor exposure ranged from about 0.02 parts per million to 0.04 parts per million. And then when we looked at the smaller room where the ventilation was blocked off, the results were higher, ranging from about 0.08 parts per million to 0.13. I just want to stress that the 0.13 is kind of an extreme example. Very few workers would be expected to work in a small, unventilated room applying hand sanitizer every 80 seconds. So this would be considered kind of an extreme exposure example. So what do these results mean, 0.02 ppm at the low end to 0.13 at the high, probably extreme end? Well, again, we compare it to the Alberta occupational exposure limit for acetaldehyde, which is 25 parts per million. So we look at our results, which range from about 0.02 to 0.13. That's roughly 200 to 1,200 times less than the Alberta occupational exposure limit that is meant to keep workers safe. These results demonstrate a considerable margin of safety with respect to occupational exposure, and hopefully will reassure staff that when hand sanitizer containing technical grade ethanol is used, it's safe when it's used as directed. Now, it's also important to point out that Health Canada has indicated that warnings should be applied to hand sanitizer whenever it contains technical grade ethanol. And these warnings include it's for adults only, do not use on broken or damaged skin, and do not inhale. And it's also not recommended for use by women who are pregnant or breastfeeding. And remember, whether you prefer to use alcohol-based hand sanitizer or soap and water, please continue to practice good and frequent hand hygiene, because it's the best way to prevent the spread of infection and to keep both you and your patients safe. Thank you.
Together, we do amazing things every day.